Good morning, everyone. I'm so excited to be with DMC alumni today and to share with you principles of functional medicine and what I have learned to optimize my patient outcomes. So I believe movement is medicine. So for those of you who are seated, I am going to have you stand up, and what we're going to do is get some circulation flowing to start our presentation. So what we're going to do is we're going to do a squat, and then we're going to raise the roof and say whoosh. We'll do it 5 times, we'll do it together, and I will count.
Sarika, what batch are you from? What?
I am 97 batch.
97 batch.
Yes.
Great going. You can do 10 squats. You can barely do
Okay, so everyone ready for the first squat? And
Whoosh!
squat,
Whoosh!
squat,
We needed this. Whoosh!
squat.
Whoosh!
Good job, and do 2 high fives for 2 people. High five, 2 people. Thank you for being a good sport. So I would like to share my story of how I started functional medicine. So I completed my internal medicine training from University at Buffalo. And as most of you know, that residency training, more than 80% of the training is to work in a hospital setting, in an acute setting. So that is what I knew. So then my first job was a hospitalist outside of the Boston area. And how many of you can relate to this? In the hospital, listening to the telemetry beeping, the smell of the hand sanitizer, seeing up to 20 patients per day that have complex diagnoses that all need notes written that day from you, and you don't have a lot of time to get to know the patient. We use the medication to treat their complex illnesses, and what I was seeing is that some of these patients were coming back after a couple of months with the same condition. So we were seeing them again for the congestive heart failure. We were seeing them for uncontrolled diabetes and uncontrolled hypertension. When they were seeing back at their primary care physician, they were not getting prevention and lifestyle answers. So I knew something was missing. And that's when I met Chris, who's now my husband. And
Hello.
he introduced me to the world of functional medicine. It was a whole new world. Any Aladdin fans here?
You're too old for it.
So to give you context, I was a new hospitalist, and I was not focusing on my nutrition because I was not taught optimal nutrition in school, and I was eating frozen meals. I was drinking Slim Fast as I was driving to the hospital, and so I knew I could optimize my nutrition. And at the time, Chris was working for a nutraceutical company whose chief science officer is Dr. Jeffrey Bland. Yes, we have some fans of Dr. Jeffrey Bland, thank you. And he's the father of functional medicine. Are any of you familiar with his work besides the one? Perfect, great. I would recommend his book called Disease Delusion. And from going to conferences with Chris, I went to Institute for Functional Medicine conferences and met MDs all over the country looking to optimize their strategies to get better patient outcomes and to look at the root cause of symptoms. So I made a decision at that time to leave the hospital, and I sought a mentor. I was introduced to an integrative doctor. I worked with him for 2 years, and I learned how to listen to patient stories and how to counsel patients on healthy lifestyle and nutrition and how to sleep better. And I learned the systems-based approach, that how the gut is functioning impacts someone's skin, it impacts the hormones, it impacts even brain health. I learned that focus on the patient and not to focus on the dis-ease. For example, if 10 patients came to you with hypertension, there are going to be 10 different causes for their hypertension, so the treatment will be different for each of them. And then from functional medicine conferences and training with the doctor, he said to me, Sarika, you are ready to open your practice for functional medicine. And in 2012, Om Healing Center was founded in Boston. In the beginning, a lot of education was needed. Patients were asking, is this a yoga studio? Is this meditation? Is this homeopathy? So we educated the community, and the floodgates opened, and the first patients were the mothers. And once they started getting better by looking at the root cause and using functional medicine testing, they would then ask me, do you see kids? Will you see my husband? Will you see my sister? Will you see my friend? And Om Healing Center then became a true family practice. And patients, before, they were frustrated, they were not getting answers from their conventional doctors, and functional medicine really helps to look at the root to help us understand why are they feeling the way they are feeling. And one of the major discoveries I learned is that once you have to treat the gut first, and then patients will start getting better, and today I'm going to show you how to do that. So modern science has validated what ancient healing traditions have known for centuries, also known as Ayurveda, that the GI tract has a central role in chronic and systemic diseases. So in the US, more than 70 million people are suffering from GI symptoms. So the objectives that we're going to learn today, we're going to learn the principles of functional medicine. We're going to describe some differences between functional medicine and conventional medicine. And then we're going to go into the 5R program for optimizing gut health. And you will learn some specific lab testing for gut health and specific treatment approaches and the elimination food plan. So we talked about Dr. Jeffrey Bland. He says, we are all here to make the lives of others better. And he, along with Dr. Linus Pauling and Dr. David Jones, all started the Institute for Functional Medicine. And Dr. Jeffrey Bland, he teaches us about the systems-based approach, physical, metabolic, physiological, behavioral. We're all connected. All the systems are connected. So functional medicine, we are addressing the underlying cause of the disease using the systems-based approach, and the patient and the doctor form a partnership. Conventional medicine is great when it comes to life-saving treatments. We definitely need conventional medicine when it comes to trauma. We cannot use acute medicine to treat chronic disease. There's an epidemic of chronic disease related to lifestyle. And the current model does not address this. This is where the gap is. So I would like to dispel some myths about functional medicine. We are not just replacing medications with supplements. We look at the root cause, we discuss the lifestyle, we look at patients' stress factors, and we focus on long-term solutions as we work together as a team. So Hippocrates said this 2,000 years ago, let food be thy medicine and medicine be thy food. So in functional medicine, we are gathering key information. When we are listening to the story, we have to pay attention to genetic factors that predispose the patient. And then we look at acute events in their life that set them up for their symptoms. And we also look at the biochemical and psychological factors too. This is the functional medicine matrix that shows that we look at the energy aspect, we look at the detoxification pathways of a patient, and we connect them all together. This is another example. We also look at the emotions, the spiritual aspect, mental factors, and we are connecting each of the systems together. Functional medicine tree. So here is a great picture describing a healthy gut on the left, where we have a diversity of the microbiome on the top. Diversity here. And then we have a strong mucosal integrity with strong tight junctions and a normal amount of B cells for the immune system. And when a patient is exposed to stress or a lot of processed food, intestinal permeability can happen. Has anyone heard the term of intestinal hyperpermeability? Okay, good. So what this means is this sets up a patient for dysbiosis, which means that there is an imbalance in the microbiome. There can be an overgrowth of bad bacteria or an overgrowth of yeast or even parasites, and then a low amount of the beneficial bacteria. And the beneficial bacteria includes Akkermansia, Bifidobacterium, and then you get disruption of the mucosa, which leads to a disappearance of the tight junctions, which then ultimately leads to inflammatory food particles that get into the bloodstream, promoting inflammation and even endotoxemia. Here's another diagram showing leaky gut, lipopolysaccharides from gram-negative bacteria leading to systemic inflammation, furthering causing insulin resistance, hormone imbalance, and fatigue, and altered cortisol response. So now we're going to come to the 5R program for healing the gut. So the first is remove. We're going to talk about removing offending agents, replacing, reinoculation of the microbiome, repairing, and then ultimately rebalance. So when it comes to remove, we are talking to the patients about the most common 8 allergens, which include dairy, gluten, corn, soy, sugar, yeast, shellfish, and peanuts. And we do this elimination for a minimum of 4 weeks to get these antigens out of the patient's system. We are also talking to them about their stress factors. And then we use specific herbs and genetically modified foods and xenobiotics. So does anyone know about xenobiotics? Yes, thank you. Okay. These are environmental allergens, most commonly plastics. So BPA is a chemical, and then these chemicals lead to hormone imbalance. Another example is parabens in beauty products and lotions. The second R is replacing what the body is missing. So if the body is missing digestive enzymes, we are using that to help break down their food. This is a really good treatment for decreasing bloating. Some patients are low in stomach acid. People with cholecystectomy are low in bile acids. And we can even use digestive bitters. And then reinoculation. So the beneficial bacteria include lactobacillus, bifidobacteria, and prebiotics feed the healthy bacteria. So fiber in the form of inulin and fructooligosaccharides, arabinogalactan, also known as larch. Fiber coming from chia seeds and ground flaxseed. Is anyone these days eating chia and ground flaxseed or psyllium? Yeah, great. Very good. This is a diagram showing the benefits of the good bacteria. So we need lactobacillus to help produce specific vitamins and nutrients. We need bifidobacteria for a strong immune system. Our gut is 80% of our immune system. This is an article, a study showing how microbiota, disruptants, leading to endotoxemia is a major factor for insulin resistance, and how lipopolysaccharide inflammation also has a role in osteoarthritis. Another article linking the gut bacteria for metabolic diseases, specifically obesity. It also has been shown, like after bariatric surgery, those patients, their microbiomes change for the better. Another article linking the gut microbiome to mental and neurological diseases, and another article for the microbiome, if there are inflammatory cytokines, leads to disruption in the HPA axis and cortisol. So this shows how this is so endotoxemia, the inflammation causing diabetes, and then there's also hyperpermeability of the blood-brain barrier leading to glial inflammation and ultimately Alzheimer's disease. So Alzheimer's disease is also called type 3 diabetes because of the link of insulin resistance. And we know the environment, each of our environments affect our microbiome, which then affects our immune system, affects our metabolism of our hormones, and can even be a factor for osteoporosis. Then we come to the fourth R, repair. We use specific amino acids like glutamine to nourish the colon cells. Vitamin D, super important. Does everyone know what their vitamin D level is?
Yeah.
Good. So our goal is around 50. That's where the research is showing that vitamin D is anti-inflammatory. One of the great nutrients for decreasing dyspepsia and acid reflux is aloe and marshmallow root and deglycerinized licorice. It's available as a chewable. And then ultimately, our goal is to rebalance the microbiome using our lifestyle, healthy food, anti-inflammatory food, adequate sleep. How many of us are getting 8 hours of sleep every night? Excellent, good. Acupuncture is a great stress reliever. How many of you have had acupuncture? So relaxing. Yoga. How many of you are practicing yoga? Excellent. That's number one here in this group. And prayer and meditation. How many people practice meditation? Excellent. This is my group. And Institute for Functional Medicine has a handout describing what we just went over. Very detailed. So we're going to come into case one. 47-year-old female presented with bloating and rash. She had bloating after meals. She did not have stomach pain, and she was having regular bowel movements. She also presented with sinus congestion for a month. She just had her first sinus infection, for which she was prescribed amoxicillin from the Minute Clinic. She had gained 20 pounds in the last 10 years. Past medical history, celiac since the age of 1. She said she was diagnosed with the intestinal biopsy, and she also had mono in high school. She also told me that she sees a dermatologist yearly. Not on any medications, and known drug allergies. I always include my food history under my social history. She had a daily consumption of coffee with milk, water, and a banana. She was eating fruits on a daily basis. She does cook all of her food, no alcohol. She was getting her supplements from Trader Joe's, so she was on a multivitamin, she was on iron, vitamin D, because we live in New England, we all need vitamin D, and a B complex. Her BMI was 25, so overweight. On physical examination, she had a thick white coating on her tongue, which does indicate a disruption in her GI flora. She was overweight, bowel sounds hypoactive, and when I looked at her skin exam on her legs, she had extensive rash, which she did not even tell me during the history of present illness. So this is her rash on her legs. She said it had been there for years. She said she didn't think anything of it. She doesn't think it's going to go away. I said this is not normal. So for her diagnosis, number 1, bloating in the setting of a celiac, the rash on her ankles, the sinus congestion with the recent antibiotic, and being overweight with a BMI of 26. So NIH gives the differential diagnosis of bloating and distension. At the top of the list we have aerophagia, we have gastroparesis, we also have lactose intolerance and consumption of sorbitol, which is a sugar, celiac disease, for which she has chronic constipation, irritable bowel syndrome, and also small intestinal bacterial overgrowth. So SIBO is a major factor for IBS. So we used the 5R program. So the first step we did was the elimination food plan. We took away the 8 most common allergens for the remove phase, and then I ordered some labs for her at that first visit. Her glucose was high at 96, so optimal glucose is 85. Her liver enzymes were mildly elevated. We check red blood cell magnesium and not serum magnesium because this is an intracellular nutrient, and it was low. So optimal magnesium is 5.8. And her candida yeast antibody was elevated. Normal is supposed to be under 1, she was 1.7, and the vitamin D was 34, optimal being 50. I also have how she corrected as she changed her food. Her fasting glucose got a lot better to 90, and I did place her on a vitamin D, like 2,500 units every day to get that vitamin D level up. So in 4 weeks, I have the first follow-up, and she said that the bloating is gone. She said the rash disappeared by 50%, and in her words, the sinuses are clear now. She realized she was eating too much sugar. She never knew that the rash could go away, and she felt lighter, less like a blob. And she noticed that the rash was flaring up when she would have more dairy and more sugar. So that's what I do. I help women make unwanted symptoms disappear without using medications. Case 2, IBS and constipation. A 60-year-old female presents with irritable bowel syndrome since the age of 23, so more than half of her life. She did tell me she was lactose intolerant. She had chronic bloating, and she was taking Heather's tummy tea, which has peppermint and fennel. Do any of you use fennel to help digestion? It's so good for digestion. She had chronic constipation with a bowel movement every 3 days. It was hard, small amount. She would take magnesium citrate to help with this. In the past surgical history, total abdominal hysterectomy at the age of 35, and that's when she noticed that the constipation got worse. She was also diagnosed with small intestinal bacterial overgrowth in 2009, for which she took 2 courses of the rifaximin, and she had a recent back surgery in January for which she was prescribed gabapentin and Aleve for the back pain. In social history, she would eat eggs every day, berries. Lunch, she had a sandwich. Dinner, salad, chicken, fish, and bread. Healthy sleep level, and she said her stress level was 3 out of 10, and she is an anesthesiologist. So this is an example of a functional medicine GI stool test, which gives the levels of the normal bacteria counts, and you can see she is low in 4 beneficial bacteria. So this was one of the factors for her. This test also checks for yeast and viruses, and it gives us markers for digestion. So the pancreatic elastase level was just made the normal at 223, which normal is over 200. And the secretory IgA level, which is an immune marker, was elevated at 2000, which tells me that, one, we're thinking a disruption in the microbiome, and then second, we're thinking food sensitivities. And then I have listed here some causes of elevated IgA, celiac disease, and we will also talk about other related celiac conditions, colon cancer, infections, so anything that's going to irritate the immune system. Infections, we're thinking bacteria, parasite, yeast. So we talked about how to treat the constipation first. So we gave her the dose of the magnesium citrate. Vitamin C is nature's laxative, so we talked about that. And a tall glass of warm water with lemon. And upping her fiber intake. So women need about 40 grams of fiber every day in the form of natural brown flax and chia. We also talked about the elimination food plan for hers. So IFM has a very great handout you can give to patients, and they break it down so you have many protein options, the dairy alternatives, healthy fats, snack options in the terms of nuts and seeds, and a whole list of vegetables. We want a pound of vegetables every day. Is everyone getting 1 pound of veggies every day?
You mean buying or eating?
And we want the rainbow. So here we have a chart of the rainbow of all the different vegetables to diversify the phytonutrients that we get. And IFM also gives us a whole weekly food planner and recipes to help our patients. So this is a sample. So we have some oats, snack is almonds, lunch is a protein and some salad, and dinner, again, protein and vegetables. So very detailed to help our patients. And a guide to eating gluten-free. Again, a handout for the patients. And another handout, eating for your microbiome. So after 1 month, she noticed that the medical food, so the medical food has in it glutamine, which is the amino acid that nourishes the colon, along with turmeric, which is anti-inflammatory, and ginger, which is gut healing. So she was taking 2 scoops of this every day, and she noticed that it was helping to coat her colon. It was protective, and it helped to decrease her constipation because it had magnesium in it. And she said, I wish these tests and treatments were discussed in medical school. I'm so glad I met you. So at the 6-month follow-up, she's saying she's doing so much better. The medical food continues to help her, keeps her stomach in a more steady state. She is avoiding dairy and wheat, and continues to eat protein with vegetables for her meals. She's saying, oh my God, I feel so great. She knew that she had a sensitivity to gluten. Because when she would try it, She noticed that her symptoms of the bloating and the constipation would get worse, so she's avoiding the bread. She's doing so much better. Thank you so much for your help. So this is an article describing non-celiac gluten sensitivity, and this originally described in the 1980s, so this is not a new finding. Symptoms improve or disappear when gluten is withdrawn from the diet. And around 50% of patients are positive for the IgG gliadin antibody. That means 50% of patients are not. So case 3, constipation. A 26-year-old female presented with stomach pain, distension, constipation for 1 year. She's been to a few doctors with no help. Immediately after eating, she had diffuse abdominal bloating, felt very uncomfortable, feels that the stomach is always making noises, popping, gurgling. She saw the GI doctor, had the colonoscopy, and it was normal. She said the GI physician didn't even talk to me because the results were so normal. And she wants to know the root cause of her symptoms. Past medical history: at the age of 17, she had strep 4 times in 1 year, requiring antibiotic courses. She also has low iron, a history of migraines, a history of anxiety, and new insomnia for the last 6 months. She is on the oral contraceptive pill. Her PCP guided her to take Miralax to decrease the constipation and Valtrex daily. She was eating for breakfast gluten-free toast and eggs, and the new thing is that daily she's been eating coconut yogurt with granola and a banana. For lunch, she cooks vegetarian, so she'll have tofu, vegetables, or the Amy's meals. Snacks look like a protein bar or nuts, and dinner she would have regular pasta with pesto. Sometimes her boyfriend would make a burger, and she did not like the taste of water, but she would drink about 50 ounces every day. So this is another example of a functional medicine stool test, which they culture the stool to make sure we are growing the beneficial bacteria called lactobacillus. So NG means there was no growth on the lactobacillus, and the bifidobacterium was adequate at a level 3. The additional bacteria did not come up in the red zone, and then the mycology, so the yeast is positive at a level 2, so PP is potential pathogen, whereas a level 1 would have been normal. So there was an overgrowth in Candida. And we also found a parasite called Blastocystis hominis. So this test gives us the sensitivity of what we can use to treat the Candida. So garlic